Good afternoon, everyone. My name is Courtney Hinton, and I am the Community Engagement Manager with Prevent Ed. Thank you. Before we get started, I'd like to thank our community partner, Living with Purpose, for hosting us this afternoon. We could have had this event easily in our Olivet offices, but having it here in the community which we serve at this space, which serves a great portion of the community doing magnificent things, sends home the message of the importance of visibility and engagement and support within the community. This particular project has been underway for about a year. Discussions of naloxone getting out into the community has been in talk since before I arrived at the organization last summer, and now we're here. So I'm not one for words, but I'm going to introduce those who are joining us this afternoon. So we have Jenny Armbruster, Deputy Executive Director with Prevent Ed, Mr. Mark Sanford, Executive Vice President of People's Health Centers, Dr. Madi Davis with the St. Louis City Department of Health. To my left, we have the Honorable Lisa Middlebrook, Alderwoman of Ward 2, which is our home here in St. Louis City, and Ms. Alicia Smith, Director of Strategic Engagement with Prevent Ed. Without further ado, I'd like to turn the mic over to Mrs. Armbruster, who will provide some background on Prevent Ed and the NaloxBox project.
Thank you, Courtney. Hello, everyone. It's great to be here today at Living with Purpose and with all of you to announce this very exciting project. So a little bit about Prevent Ed. Since 1965, we've been serving the eastern region of Missouri, which includes St. Louis City and the 6 surrounding counties. Our mission is to reduce and prevent the harms associated with alcohol and other drug use through education, intervention, and advocacy. We fulfill this mission by serving over 100,000 people each year through our school, community, counseling, and peer services. In this mission, we know that our focus is on all substances and the harms and the consequences that are associated with those. But over about the last decade, our focus has been largely on opioids. This has been a large focus of our work as we have seen how it has evolved in our communities and some of the consequences that individuals in our communities are facing. We know there's been different waves of the opioid epidemic, starting with a rise and an increase in the misuse of prescription medications. And then as we started to address some of the challenges there, we started to see a rise of heroin use across communities in the St. Louis area. And today that third evolution has happened, where we have seen the presence of fentanyl in our illicit drug supply. And so we know fentanyl as a very powerful opioid is a substance that is causing more overdoses in our community. So as a powerful opioid, fentanyl is mixed in with the other illicit drug supply. So not only is it present in a substance like heroin, but it's also present in other drugs like methamphetamine and cocaine. So for some people, they might be using fentanyl very unknowingly, not realizing that it's present in the substances they're using. And even people who regularly use drugs, it still presents a large risk to have fentanyl present in the drug supply. Because of its potency and how powerful it is, people are not accustomed and they don't have the tolerance to this powerful substance being present, which often can lead to a fatal overdose. We also know that overdoses continue to be a crisis in our communities. As we review some of the data and we look at the numbers, the stats show us that the St. Louis region has the largest number of overdoses throughout the state of Missouri. So we know that more overdoses are happening here in our community and in the city of St. Louis than in other areas throughout Missouri. We also know that overdose rates are disproportionately impacting Black males and females. We see higher rates of overdose among Black males and females than their white counterparts. So we know that the risks are great, and we know that our crisis continues and our efforts must continue. And that communities are constantly searching for ways that we can address this problem. Prevent Ed has explored some of these strategies, engaging with other local partners like Living with Purpose to figure out how can we get solutions into communities? How can we bring it to people and make sure people have access to ways to help prevent fatal overdoses? This strategy that we're here to present today is one other strategy through the Opioid Project with this device called the NaloxBox. So what is a NaloxBox? A NaloxBox is a device or a box that can hang in different locations and entities where there might be higher risk of overdoses occurring. These NaloxBoxes contain the life-saving medication called Narcan. Narcan is an opioid reversal drug. In the most basic of terms, it just kicks that opioid receptor or the opioids out of the receptors in a brain and allows a person to start breathing again, preventing their fatal overdose. It's a nasal spray, very easy to use. And so with the NaloxBoxes, we want to be able to have this medication available in communities when people need it. It's not good enough to be sitting on a store or on a shelf somewhere in a storage room or available only at a pharmacy. We need to make sure it's available everywhere in the community because we know overdoses happen in communities. As we see people continuing to use more of this potentially fatal fatal substances, and we see it in our supplies, we also know that overdoses occur in communities, on the streets, in homes, where we need to make sure that people know where they can access Narcan. So as Narcan has become more widely available, we have looked at how can we reduce the barriers to people getting their hands on Narcan. And the NaloxBox is a fantastic strategy. So this strategy was recommended by one of our Prevent Ed partners. Her name is Pooja Reddy, and she created the Opioid Project while she was still in high school. She recognized this need to look at different strategies of how to address overdoses and opioid use in communities. And she wanted to make sure that we were able to engage at that community level. Unfortunately, she can't be here with us today because she is off pursuing her dreams and following her passion and path of looking at how she can continue to help serve people in communities and is currently enrolled in med school. So we gave her a pass for today and didn't make her come to our press conference. I think med school is more important for her at this moment. So like I said, the NaloxBox is just one tool in our toolkit. We know that this opioid crisis is greater than one strategy to be solved. It's greater than one organization being able to have all the solutions. And that's why these partnerships and these community efforts where we can combine forces and increase public awareness, increase education, increase access to treatment, and make sure that people really have the services that they need in order to help them reduce substance use, to stay alive and have more harm reduction when people are using drugs. So there's no one answer, but this variety of strategies. Over the last year, Prevent Ed has worked to outreach and build our community advisory board with partners here in the room. And we're grateful that we've had so many people willing to come together and join the table to really talk about solutions. And as we began to brainstorm and think about different ideas, the NaloxBox is one thing that really kept coming up as a strategy that we could get behind, a strategy that we can make work. And so we began to brainstorm different areas. We looked at data and community needs. We looked at the information out there to see where would NaloxBoxes be most helpful. And we began to put together some different plans for those things. And as those plans continue to develop, we knew we needed a partner. We needed more partners. We needed a funder who understood the challenges and were committed to finding a solution. And one of those partners that we were able to secure is People's Health Center. And now I'm happy to transition to Mark Sanford with People's Health Center.
Thank you all. My name is Mark Sanford. I am the Executive Vice President of Betty Jean Kerr People's Health Centers, and I'm also the Executive Director of People's Community Action Corporation. So when you look at Betty Jean Kerr and our 50th anniversary on either side, what that represents is a culmination of community-based work for all three corporations. We also have under our umbrella Hopewell Mental Health Center and People's Community Action. So as a dual executive on both executive teams, it was a given that I would arise and cooperate with the coalition to provide at least one tool that could be used to help prevent more overdoses with opioids. People's Health Center itself has been around for 50 years. This is our 50th anniversary, so we had lots of programs to celebrate this year. The Community Action Agency is only 10 years old. The Hopewell Mental Health is 34. So what we're doing now at People's, I just say People's, is we're reversing. People's is the big sister, Hopewell is the small sister, and PCAC is the baby sister. So what we are trying to do this year is to reverse that priority. People's Community Action Corporation was the part of the health center that provided this particular resource to the community. And we do that throughout community engagement initiatives, the initiatives we have with the by state, initiatives we have with schools, and we thought, why not? We don't have on the community action side the staff that basically does a lot of the treatment. So what we do is we engage the community. We engage in partnerships. We engage with community businesses. We engage with certain zip codes to provide better access and greater access to services and programs that either one of the three corporations had. So it's just been my pleasure when I was approached about the coalition to be a member. It was my pleasure to provide this resource to those community partners and to the city of St. Louis and St. Louis County. So together, between the three organizations, we're able to provide access to maybe 50,000 users a year. And with that, we've got over 150,000 visits. But either way, we wanted to provide a seamless access to service. So if you come through the community action, you have access to mental health, you have access to primary care. If you come through primary care, you have access to the other two organizations. And that's what we try to do. So we're very honored that we were selected as a partner with the coalition to be able to provide this. And we will continue to do our part to grow and sustain the movement in regard to opioid overdoses and that reduction. So thank you.
Good afternoon. My name is Dr. Mati Tlachwayo Davis. I'm the Director of Health for the City of St. Louis. And what a joy to join you today. What a joy to be able to partner with Prevent Ed on one of the city's most crucial priorities, and to actually see that done in work. May this be only the beginning of a fruitful partnership, and I really thank you for letting me join today. So, thanks to Prevent Ed, the City of St. Louis would like to announce its partnership through the Department of Health and the St. Louis Division of Recreation. We will soon have yet another tool to assist in preventing opioid overdoses. You heard today the devastating impact that opioid-related overdose deaths have had in our city and our region. This is not new. This has been happening for years and years and years. It has been exacerbated through the COVID-19 pandemic, and quite frankly, has burdened Black and Brown communities disproportionately, consistently throughout this time. So when I say that it is a true honor and a pleasure for me to be here, it is because I enjoy days where I get to come to work and see visible ways, tangible ways, real ways that we can impact the communities that deserve it more. Thank you so much to you, Alicia, to Evelyn. Public Health now in the city of St. Louis is taking a big step forward with the placement of these NaloxBoxes at recreation centers throughout the city. These are the places where we commune. These are the safe places that our children go after school. And they will now have an additional asset to be safe. And not only that, to have trained staff through Prevent Ed's intentional partnership to be able to educate and keep the people that we care most about safe. These boxes, which will contain overdose reversal medication naloxone, a life-saving resource that was traditionally administered by emergency response personnel, will now be available to minimally trained laypersons and allow for greater and quicker public health administration. This is what gives me joy, because I'm a physician. I'm an infectious diseases doctor. I've gone to school a long time to do this job. And so people in medicine love to keep the work of medicine to themselves. But I jumped ship and I became a community leader first and a medical doctor second, because I understand that we have to train the trusted messengers, the trusted in our communities, to really make this work impactful. Medical communities, Government communities have failed Black and brown communities for decades, going back to slavery, through the Tuskegee experiment into present day. Those inequities in health make it so that we need our trusted messengers to lead this work. And that is why this partnership with Prevent Ed is so important. Data shows that national synthetic opioid deaths began rising as early as 2013. Our data shows that over the past several years, synthetic opioid overdose emergencies have occurred far too often in the city of St. Louis. Fentanyl deaths almost doubled from 2018 to 406 from 2017, and in 2020 remained stable at 400. During the first half of this year, from January through June, overdose fatalities have affected residents of 18 of the city's 29 zip codes. The highest number of fatalities occurred in 63118, 63111, 63115, 63108, and 63112. I will always bring you zip code level data and call this out by name because we will not do this work, which is why I'm so thankful to see our leadership from the Board of Aldermen who have supported me since I started this job and who take this work into those zip codes and communities directly. Thank you so much for your work. These zip codes span many of the areas of the city and have a high percentage of poor Black residents who also face significant barriers around structural determinants of health, making this even harder. Although naloxone can be obtained at pharmacies and is on all EMS vehicles, making the medication available and ensuring awareness about it at our recreation centers will provide opportunities for speedier responses if an overdose occurs. We don't have time to wait. We just don't have it. Our children don't have time to wait. NaloxBoxes are a great example of taking a public health resource and meeting people where they are. We have to bring public health solutions into the community instead of continuing to use models where residents come to us or other healthcare providers. I'm tired of strategic plans, y'all. I'm tired of of PowerPoint presentations, conference after conference. Let's do the work. This is the work. The Department of Health is looking forward to working with Prevent Ed and the Division of Recreation to sustain this program. Keep me accountable, y'all. This is my job. Thank you all.
Thank you, Dr. Mahdi, for those great words. Now, how long did you go to school to do what you do? I was going to say like 6 months. Okay. Got it. All right. Thank you very much for your. And next up, I would like to bring up the Honorable Lisa Middlebrooks.
Thank you. Good afternoon, everyone. I would like to thank Living with Purpose and Prevent Ed for hosting us and everyone in their respective places. Living with Purpose came into the second ward running, not walking, trying to find out the needs of the community. Not only did they do that, they set up a round table. And the next thing I know, Prevent Ed was there. And everyone was coming up with data that helped to get us here. And everyone wanted to find a solution. As an alderperson, what I find is when people come to me, they want to come to a judgment-free zone. They want to know, how can we help our daughter? My husband needs help. My mother, my father, my friend, my partner needs help, but I need to be in a judgment-free zone. I need to understand what I'm doing with this. How do I get them out if they overdose? This NaloxBox helps them to be in a judgment-free zone. It gives them the tools that they need to keep their loved ones alive. And I just want to thank Living with Purpose and Prevent Ed for bringing this to us, bringing it to the second ward so we can keep our city residents and our county residents alive. So thank you very much.
Good afternoon, everybody. My name is Alicia Smith, and I am Director of strategic engagement at PreventEd. I want to thank you all for coming out this afternoon. We wanted to begin this process and end this process with the same theme, and that theme is community, community, community. Because we could have had this press conference at PreventEd in our offices or at People's Health in the offices, but we felt it was so important to get out in the community to make this announcement. At this time, we want to thank our financial partner in this partnership, People's Health Clinic. Let me do a clap. There will actually be, they are going to purchase 100 of these NaloxBoxes to go out into the community. The reason why this has been a years-long process is we have taken it started in the community through our PreventEd's Opioid project, then through our Community Advisory Board, all the way to the NaloxBox Community Selection Committee. The community has pulled together, created this committee, and they are going to determine in all of the zip codes in the city and in North County where these boxes will be placed. Many partnerships have begun, as Dr. Mahdi kindly said, with Parks and Recreation. They will be in the Recreation Department, but also another city, quasi-city department, the St. Louis Housing Authority. All of the multifamily units will have NaloxBoxes. So this is just the beginning. Like I said, 100, we've decided on 50 locations, and we will continue to meet until all the NaloxBoxes are placed. So thank you. We want to recognize also all of the grassroots community organizations that live and breathe this work every day. These statistics that everyone talks about the lost lives in St. Louis region, those are numbers. But to these grassroots organizations, they are family, friends, classmates, and neighbors. So this is important work that has to happen quickly. And that's why once we got it going and once we had a vehicle to do it, you will see these boxes out in the community. I want to thank all of these grassroots groups for your mission, your daily work, and your commitment. And I am going to list them: Living with Purpose, Grow STL, Restorative Justice, Wellston Loop CDC, and Williams and Associates. So thank you, everyone. And if you can, be sure to take the little brochure, say this, not that, because words change, and it'll be a good tool for you going in the future. We look forward to working with all of you because we have representatives from all of these new partnerships.